Hey fam, welcome back to the Gilead Gazette, your weekly roundup of the war on women's bodies, rights, and autonomy. This week, the government is using Child Protective Services to stop mothers from helping their daughters access reproductive health care. A new study confirms women are dying because of abortion bans, and we're just scratching the surface. An Iowa woman was denied care for a fatal fetal diagnosis because her doctor was more afraid of prison than of losing her. Missouri wants to force doctors to perform painful procedures on newborns with fatal conditions who can't survive, and the Supreme Court's pause on the mifepristone ruling expires Monday. Let's get into it. This next story is an Abortion Everyday exclusive, and I'm linking to the full article in the description and comments because every person you know needs to read it. Child Protective Services is being used as an anti-abortion weapon. Multiple cases have now been documented where CPS was deployed not to protect children, but to stop mothers from helping their daughters access reproductive health care. In one case, a 14-year-old girl in a state where abortion is banned was taken from her mother without a court order to prevent her from accessing care she had already planned and scheduled. The CPS caseworker threatened the mother with murder charges and told her that her toddler would be taken too. If, when, how got involved, legal counsel was retained and the teen was returned 5 days later. By then, the appointment was gone. She was forced to give birth. And then, because this country has completely lost its mind, CPS opened a new investigation into the teenager for being a young mother after the state forced her to become one. A second mother in a state where abortion is legal and constitutionally protected took her 17-year-old to the emergency room after her daughter developed a fever following a medication abortion. She told the hospital staff everything because she thought that was the responsible thing to do. A hospital social worker called CPS and police. Both agencies opened investigations into this mother for taking her sick child to the hospital. If When How's helpline now gets 300 calls a month. When it launched in 2018, it was 5. If you or anyone you know needs legal help related to a pregnancy outcome, the number is 844-868-2812 or repohelpline.org. It's also in the description. If you missed yesterday's video, Florida Republican Representative Kat Cammack introduced a national ban on the medical procedure used in the vast majority of second trimester abortions. The same Representative Cammack whose own ectopic pregnancy treatment was delayed by a Florida ban in 2024. Doctors were too scared to treat her. She blamed pro-choice advocates for fear-mongering, then introduced a national ban. Watch the video. Share it. A new Johns Hopkins study found 9.2% increases in pregnancy-related deaths in states with abortion bans. Each death preventable. We know of at least 5 women by name: Joselie Barnica, Portia Ngumezi, and Navia Crane in Texas, Amber Nicole Thurman, and Candy Miller in Georgia. Researchers say these are the tip of the iceberg. Louisiana mothers are 3 times as likely to die of pregnancy-related causes as mothers in states that protect access. 3 times. The people who pass these laws call them pro-life. I would love for someone to explain that math to me. In Iowa this week, a woman named Jessica Duvanovich was denied reproductive health care even after her pregnancy was diagnosed with a fatal fetal condition. Her doctors told her the state's emergency exception exists in a gray area, meaning doctors are doing legal math instead of medical care. Jessica said they're more worried about legal recourse than they are about saving a woman's life. That's disgusting. That's not medical care. After weeks of uncertainty, she finally got care that she should have been able to access immediately. She was lucky. Not every woman is. Iowa has the lowest rate of OBGYNs per capita in the country. The abortion ban made it worse. This is fine. Everything's fine. Nothing to see here. Hey, in Missouri, the Born Alive bill just passed out of Senate committee and is heading for a full Senate vote. This legislation forces doctors to perform medical procedures on newborns with fatal conditions who cannot survive, regardless of the family's wishes, regardless of medical judgment, regardless of the suffering it causes to a dying infant. It robs parents of a peaceful goodbye to a child they already know they're losing. Republicans call it protecting life. Hey, someone should buy them a dictionary. And finally, Monday, the Supreme Court's temporary pause on the Fifth Circuit's mifepristone ruling expires May 11th. That ruling would eliminate telehealth access to mifepristone nationwide. Mifepristone is safe, effective, and used in 2/3 of all reproductive health care procedures in this country. Contact your senator and tell them to oppose any legislation restricting access to reproductive medication. Share resources like Plan C and repohelpline.org, and share this video. The quiet is what they're counting on. For the most in-depth reporting on attacks on women's rights, follow Jessica Valenti and subscribe to Abortion Every Day on Substack. They are essential, and they are the reason we know any of this. Stay angry. Stay loud. Under her eye.